Hello, everyone. We will begin in 2 minutes, just allowing more time for more members to join. All right, I hope I'm audible. Good evening, everyone. It's so nice to see all of you join this webinar, and I would like to welcome you all. Kindly drop in the chat box your name, where you're joining from, so that we interact even as we move forward. You can also remind your friends and send them a link so that they're able to also join the webinar. So today we are holding this commemorative webinar to commemorate the International Youth Day 2026, which is usually observed on 12th August. So it was observed on Tuesday this week. So this webinar is to commemorate the International Youth Day. And today we will also be launching the youth guide to health financing, which is a guide that was developed by Equicare Strategies. So kindly stay till the end so that you're able to get to that part. So without further ado, even as you drop in the chat box where you're joining from and your name, we would like to begin because of time. We're 10 minutes past the time, and we would like us to begin so that we end within the hour. Right. So to start us off, first, as I mentioned, this is a commemorative webinar to commemorate the International Youth Day. So I'm sure you're wondering, so what is the International Youth Day? What is the significance? So to first begin this webinar, I would like to welcome Sylvia Ntamwinja, who is a member of the Partnership and Development team at Equicare Strategies, to give us a short talk on what is the International Youth Day, where we commemorate it, and the significance on us as the youth. So I'm not sure if Sylvia, you're available. Maybe you can unmute and take over.
Hello.
Yes, Sylvia, we can hear you. You can proceed.
Awesome. So thank you for the introduction. I'll put it very simple. And what is the International Youth Day? It's quite self-explanatory, the day when we celebrate the young people. And So a brief history is that this year marks the 27th, no, sorry, yeah, the 27th time we're commemorating International Youth Day, but I'll give a background on all of this. So in 1995, um, j- um, just a minute. Yes, I have them right. So in 1995, the UN adopted the World Programme of Action for Youth. So it was just a decision. They realized that they needed more voices of the youth, and so that like they can be able to address the problems that the youth are facing. And that was done successfully. And however, in 1998, during a World Conference of Ministers responsible for youth, they recommended that 12th August be designated the International Youth Day. So that's 1998. And so the next year, during the UNGA, now the UN General Assembly, that's 1999, it formally endorsed that 12th August is going to be the International Youth Day. So once they agreed that in 1999, now in 2000 is when we had like the first International Youth Day observed, and it's been done every other time up to like this year, 2026. So maybe as I continue, you can type in the chat box what was the theme of the International Youth Day 2026. So as you have heard, there's normally different themes every year, and that helps like different stakeholders to have action towards one area, like just the way we have other international days, like maybe breast cancer awareness month or day, or like mental health day. Every of those international days have themes so that different stakeholders can work together in terms of achieving a certain goal. And when the first um international youth not delegation per se, but when they began the whole activities, or from the first proposition in 1995, their main um, focal areas were participation, development, and peace. So they wanted like youth participation, which has evolved over time to like meaningful youth engagement, and then now having youth in development activities, and then peace, which I believe was a very key area even in the 19th. So having youth as integral in spearheading this. But then as years have continually evolved, then we keep having different challenges. So you find that every year there's something that the youth from the different areas would be focusing on in terms of your country and all that. And right now we have common conversations on climate health, mental health, AI, access to education. Sorry, we have aspects like political participation. So it's quite a wide range. But then now the question is, why is this day important? Number one is that having an International Youth Day gives the visibility the youth need in terms of, well, it's not like a sustainable, but at least once a year we have many people having that conversation about the youth, and many organizations keep the resolutions even after the International Youth Day. And then now even governments are able to recognize efforts of the youth. It's really vital. I think in Kenya, the recent one, we had a whole summit on, after we have a vision 20, after the 2030 vision 2030. So what after, so it's like the conference of the future, and having youth from different areas just having the conversation, so it gives us platforms in the different spaces that we need to be in, from healthcare to policy spaces to government and all. And I think having that background, now you are even able to integrate it with the conversation we have today. But just to wrap it up, we should keep celebrating ourselves as youth kindly. Let's ensure we always show up, celebrate what we are doing, celebrate what others are doing. And when the International Day comes, let's even magnify the effort. But that's not the only day we are celebrating each other. And even in your spaces, now that we are very recognized from local spaces to international spaces. The question is like, what am I as a youth doing to take advantage of the opportunity that is availed as by you being a youth, and not that the opportunity is like dashed out to you. It's something you fight to be in those spaces, but it's worth the fight, and at least we have a whole global backing for us. So that's just mainly it, and let me hand it back to Mercy. Thank you.
Right, thank you so much, Sylvia, for providing such an amazing background on what the International Youth Day is, and having now that background and understanding the relevance of it. We, as the young people, even though we come from different countries, you have those from Kenya here, those from Nigeria, and other parts of Africa. We're also from very different communities, but we all share many things in common, and one of the things that we share in common is that we as the youth, I'm sure we all aspire to live healthy and dignified lives. And one of the ways that we can achieve this is understanding how health financing actually occurs. So building on that, then in the next session, I want to invite the executive director for EquiCare Strategies to give us a short understanding or background on why we as the youth matter, especially particularly in the area of health financing. So probably in 10 minutes, I'll invite the executive director, Joshua. Maybe you can provide us a background on and emphasize the importance of the youth, particularly in health financing, even as we tie back to the International Youth Day and celebrating what we as the youth have done so far and what we are doing, and understanding that our decisions also matter in health financing. So I'm not sure if Joshua, are you around?
Yeah, I'm here. Thank you very much
All
for
right.
that. I thank you very much, and thank you everyone for being here and for also for the opportunity. I just hope that everyone can hear me clearly.
Yes, we can hear you clearly.
All right, thank you very much. And I'll discuss more further on this subsequently. But just to give you background, and when we are talking about health financing, it basically affects almost every single person, not just and young people are being affected. Young people are even one of the major people that are being affected by this. When health is not financed adequately, maybe let's say child health, maternal health, or maybe maternal health is going far, but when we're talking about child health, adolescent health, and young people are one of the major and key having issues in these particular key areas. And health financing is very, very important. And when we are talking about health financing, I'll give more details subsequently. But looking at the entire health systems architecture as a whole, health financing is like one of the core pillars of it. Basically, like an engine that sustains most of what is happening in the health system architecture completely. So, and when we are talking about an area getting essential medicines, when we are talking about having healthcare workers, when we are talking about and having quality healthcare services at every level, and health financing basically finance, how will I say now, and serves as an engine that makes these things possible, right? And even governance also that we might not even think that may not require that, but it also requires health financing, right? So it works across almost all areas of our health system, and it's very, very important for young people to young people are not outside the system, they're actually inside the system. And health systems basically provide healthcare for the people, not for other people, like for the people itself. And young people are the majority. For instance, in Nigeria, where young people are basically the majority of the population. Even in Africa, young people are forms around 60% of the population. That's from the last statistics that I saw. And so, and if you are looking at this, that means young people are the majority of the population. Now, in Africa, it's like one of and the largest continent like in the world. And looking forward, maybe it's 2030, and the rest, Africa will basically has one of the largest youth population that we have on like in the world globally. So it's very, very important that we are involved in this because this is things that will affect us. Now, another reason why young people are also very essential is because we are looking at the future of healthcare. So let's say, for instance, the government is investing in healthcare adequately at this current moment, or let's look at another scenario whereby the government is not providing enough resources for healthcare at the not just generally not providing at all levels, right? Let's just put it at all levels. It's not providing adequate and resources. Now, the inadequacies of the healthcare at those levels, at different levels, right? Apart from that, also the challenges that we might have at that level is not something that will just like happen and can be fixed in a moment, right? It's something that will stay for a long period of time. And if government doesn't invest in healthcare for the next 5 years, and most of the consequences we might not even see it at this current moment, it's usually in the future that you usually see the impact of it showing. And it's just like see if someone is laying a very faulty foundation for you, building a faulty foundation for you, he might not basically have those consequences may not affect him because he might leave, he may not be around for that long period of time, but you are the person that will subsequently be in that system, right? So whatever might be the government or let's say us as the people are contributing in healthcare at the moment, and those are like it's people that will stay for the longer period of time that this might affect them, and these people are basically young people that will have most of the impact. For instance, what we are currently facing now in healthcare is not something that started today, it's something that has happened for a long period of time, and we are currently experiencing the consequences of it. I think it was in 1987 that we had, and whereby earlier primary healthcare or healthcare in Nigeria was literally, I wouldn't just say subsidized by the government, but it was like free for everyone. So we had a lot of issues with and loans, government. So there was kind of like a restructuring that they had to do. And they had to do like certain restructuring in how funding at every sector goes in, and it affected us basically collecting loans, World Bank loans, and all. So there are certain policies that had to be put in place so that and the government resources can adequately be used, and that's where it started becoming privatized, and we started having issues with people not being able to access healthcare. So these things didn't started today. It's like started for a long period of time. But we are currently having the impacts now, and it's feeling as if that's how normally it's happening, but that's not how it's supposed to be. I understand that healthcare is actually not supposed to be free. Someone has to pay for it, right? But when we don't have like and people don't care about it so much, it will have like a very, very bad impact on the next generations. And we are basically the next generation that will be affected, right? And so it's something that we are supposed to be involved because we know that this is still something that will impact us, not just and like not just and maybe the people maybe just happen for the next 2 years or 3 years. No, but this is like something that will impact us in the next 10 to 20 years, right? So it's something that we should be involved in. So I would like to stop here, not to take so much time, and we can proceed. Thank you very much.
Thank you so much, Joshua, for uh, that address. But I don't think you'll be going off for long because you're also coming in for the next session. So in the next session, we will be finally now launching the youth guide to health financing. Just a minute, let me share the slides. Okay. Um, screen. All right, kindly let me know if you're able to see my screen. Joshua, are you able to see the screen?
It's still loading. I've not seen it
Okay,
yet. Okay,
right.
it's clear.
All right. Okay, so given that we understand that if young people we are going to have a voice in shaping the future of health financing, then first we need to have the knowledge and even the tools to understand how those systems are financed, just as Joshua has mentioned. And that is the idea that we will be launching today. We are launching not just a resource, but a tool that will enable and equip young people to be able to first understand health financing and now be able to use that information to be able to participate meaningfully in health financing. So without further ado, I would like to welcome back Joshua, who is the Executive Director for EquiCare Strategies, to lead this session where we'll be launching this important resource, which is the Youth Health Financing Guide. So Joshua, you're welcome back.
All right, thank you very much for the opportunity to take this, and it's a pleasure being here once again. So thank you everyone, and thank you for being here. So for this health guide to health financing, we didn't just like and just started it just like that. We basically had like a background of what we're trying to do. So part of our budget for health campaign, we are basically looking at how and we can have a more efficient health financing structure in Nigeria, and we are looking at both accountability, transparency, and also increased investment and at government investment in healthcare at all levels, from federal, state, and also at local levels. That was what we're trying to achieve. And we believe young people are a major agent of change. Please, you can move to the next slide. Young people are a major agent of change for us to be able to achieve this. And we understand that there are certain challenges that young people may have in be able to achieve this. Just move to the next slide. To be able to achieve this, there are certain issues that we've seen. So, and one of the major challenges we saw was that, and if we wanted young people to be involved in health financing advocacy, right? And one of the issues we saw is that a lot of young people don't even know what health financing is, right? And when we say just health financing, it just sounds like, okay, health finance, like that's money for health, right? It just stops there, right? And you may not have like a clear overview of what exactly is, how exactly it functions, and how exactly can I be involved, right, to be able to solve these issues. And with the cut in funding, with the issues we are currently having, and across the world globally, young people are supposed to be involved in this because this is like a very, very critical moment. And a lot of them don't have like are unaware of these issues, right? And some of them don't have and the capacity also is not there how exactly to advocate and all. Now, apart from that, again, some certain issues that we also saw was it was exclusion also. Now, there's just a normal stereotype that, okay, if you are a young person, and most of the time, what they usually take is that, and you don't know. Like, if you're a young person, you don't know. Like, it is normal Nigerian culture, or let me just say an African culture, right? And when they are, that's why if you check most of our decision makers, yeah, you'll hardly see a young person, right, being involved, right? You see someone like I don't want to call names or anything, but you don't usually see young people being involved, right? So there's that youth exclusion in this, and there's just particular stereotype that okay, young people are not usually involved, right? Now, apart from that, also concerning youth exclusion, and there's also something that they usually do, and it's basically tokenism. I hope I'm pronouncing it correctly, right? So they'll just say, okay, want to involve youth, we want to do engagement or something like that. And they'll just bring young people and they'll just talk, and that's just all. You are not like your contributions is just like for sure, right? So that it will not be like we did not involve young people. So that after where we can say that, yeah, young people were involved when we were making this decision, but most of the decisions were not made by them. They just heard them and say, okay, that's all right, that's fine. We already have something more better than what you're presenting. We understand what you're trying to say, and that's just all right. They don't necessarily make those decisions, right? They're usually excluded. That's one issue also saw. Another issue was funding and resources for young people. If you check most your youth-led advocacy and the rest, you hardly see funding for that and all, right? That young people need to go looking for individual funding, sending letters here and there and all. Or if we can even take a head count here, let's even start, let's say, most of your youth associations, right? Let's just even start from there, not going far. And I believe almost everyone is in a youth associations here. Medical, let's say medical lab association, or let's say another association and all. You hardly see any like funding directed to them. They have to go and like look for this funding and all for their programs, for things they intend on doing. They need to go and beg this, beg this, beg that, and solicitation and all those stuff, right? You don't usually see like more focus towards them, right? So those are like some of the issues also. And networking platforms, they don't have these, and inequities affecting the general African population. When we are talking about inequities, let's say poverty, literacy, and you don't need to like you don't need to struggle to know who exactly is being affected, right? You just know that who is the larger population, your young people, right? Youth are the larger population. So if there's a problem, who will be affected more? It's definitely them, of course. So these are things that we should also take note of. And fear and engagement failure. Another thing is, so young people are afraid to engage also, because based on how they have been stereotyped, how they have been excluded for long, they see it as okay, what am I even doing? Even if I try, nothing is going to work out, right? So these are some of the things that we saw that are affecting young people. And we wanted to have like a more and like something that can cover most of what we see, and building, since we are trying to, young people are the measures of edge of change for this campaign that we intend on doing, right? So, and the awareness is something that's very, very important, right? First of all, you need to know, right? Knowing is very, very important. You need to know first before you can start taking action or something. So we saw that there was no any guide to doing all this. There's literally no any guide to health financing that is directed towards youth. I'm not sure if there's even a like guide for health financing. Okay, there is, but they are not like structured that okay, this is a guide for health financing, right? It's usually maybe part of a course or something like that, right? So we wanted to build and something and better. Oh, really sorry. We are seeing face groups rate review here. But it was actually created Google Google Slides. So on slide, that's why showing this. It's actually so, and this is open on PowerPoint. That's why it's showing this, right? But it's all right. So and so now I wanted to hear from any of you. So you can just put it in the chat. And when we are talking about health financing generally, what comes to your mind? Like when we're talking about health finance, are you thinking of government budgets, or you're thinking of out of pocket hospital bills, health insurance, or anything else? Like when we're talking about health financing. Please go back to the next, like the previous slide, please, before this. Just put it in the chat box. Just put it in the chat box what you think health financing means to you. Please, can you go back to the other slide before this? Yeah. No, no, no. The next one. So please just, you can just write, no, no, no. That one that is showing face and the rest, that was where I'm supposed to start from. So just put in the chat what health financing means to you when it comes, like when they say health financing, what exactly comes to mind? Like what is the first thing that comes to mind when they talk about health financing? What is the first thing that comes to mind when it comes to health financing? Now, while you are putting that chart, I wanted to told you. So those are some of the challenges that we saw. Those are the things that made us to start the campaign generally, right? That was what made us start the campaign. Now, for development of this youth guide, we had a team that developed it. So, and there was me. They have the capacity development team, and so most of what we have in this youth guide is basically lessons that we've learned based on the fellowship program that we did, right? So we had a 5 month capacity building initiatives where we had different sessions on health financing, on advocacy, communications, M&E, and the rest, right? So most of the learnings that we did, so we covered a lot of key areas around health financing, or we brought in different experts to talk about these things, right? So most of what was discussed during these sessions, we worked on them and developed like a guide on health financing based on that. So based on those learnings, that was what fed and the development of this guide, right? That was what was used to develop this guide. Now, when it was developed, we had some experts to review it and give their own feedback on basically what we had, like some of what we were able to compile based on the training and everything, right? So that was you can see the name of the expert reviewers, the capacity development team that was responsible for this. So they were magically responsible for that. Now, I think only one person wrote and what they think about health financing. The person said it's a process involved in funding the healthcare system of a nation. That's right. Anyone else that would think about, like, when they talk about health financing, what is the first thing that comes to mind, right? So now, and one of the things that best illustration that you might have is, I believe most of us have experiences in the hospital. Maybe you just think about how and you've gone to the hospital, let's say last 2 years or this year, and anytime, or maybe you've not been going to the hospital, let's say let me just use the pharmacies now, right? Maybe you went to go and get a drug or something like that, right? And let me just use that one for instance, because that one is very, very common, right? Let's say you went to get a drug, let's say it's PCM, paracetamol that you went to get. The pharmacy, you're having like a slight headache. You're supposed to consult your doctor, and those drugs were prescribed. I went to the pharmacy to get them, right? Now, and what you are currently having is you are already in the system, they are already in the health system, right? You're in the health system, and there are certain things that have to work out for you to be able to access these healthcare services, certain things that have to work out. And it might be you will need the health workforce. Please just move to the next two slides. You might need the health workforce, that's most likely the doctor, for him to see you, or maybe the nurse that needs to see you, or you are just looking for the drug exactly that you need, or maybe you are looking for the finances, right? That you are going to buy these things. Most of the time, that's how it works. Now, and when you're in the health system, right, there are different things that work hand in hand for you to be able to achieve this. For you to see your doctor, he must be trained, he must be in a hospital, and for you to see that, and the hospital must most likely under government or may have like a leadership structure, right, that functions. Now we have health workers that are working in that hospital, right? We have where your patient's records, data, and everything is kept, right? Then even the medicines that you need, that you require, let's say in the pharmacy or not, needs to be available, right? Now we have the financing aspect that is a core pillar that also helps for these things to happen, and the service that you're able to get, let's say you're able to see the doctor, let's say there's a test that you need to do and all those stuff that you need to do in the hospital. Now, financing basically functions like an engine in these systems. And when we are looking at the leadership, this leadership structure need to be paid, salaries, workers need to be paid also. And there are certain things that need to function when there is no when the financing is not there, right? So you come to a particular healthcare facility and you won't see a single doctor there. The reason might be that there is no funding for healthcare work, like the health workforce hasn't been funded, right? Now, if we are looking at it through the health financing lens, right, that hasn't been provided, right? Let's say in your current primary health, like in your ward, there is no a primary healthcare center, right? That means the leadership of that community may not have funding to be able to get like develop a PHC, a facility there at the local level, or it might be corruption or something might happen, but this is not to happen, right? Even your data to be stored and all these things, they literally functions on this. So that's why when we talk about health financing, it's something very, very important because it's most like basically like an engine that and supports how these systems work. Now let's move on and to the next. And now the youth guide that we developed, and we looked at these key store issues and we and developed the youth guide explaining certain concepts. So when you open the youth guide, it's and discuss certain concepts that we believe young people need to understand around how health financing operates, right? This what I'm going to share now will just be a like an overview of what's in the guide. We share the guide so that all of you can go through it and see what exactly it's like it contains, right? But for the youth guide, we're looking at first of all, we looked at what health financing is, and we broke it down into because health financing is more around how revenue is mobilized. We are looking at how the funds are pooled, and we are looking at how those funds are being used to purchase services, right? So those are and how have first had to like give an overview what exactly is health financing itself and um, how exactly can young people basically understand this, right? Now, for just to summarize, for health financing, we are looking at how funds are raised, allocated. But there's something important that you should take note is, and suffering financially is not like if you have a how will I say health need and you are suffering, like it causes you to have an issue like with your finances, whereby maybe you become broke or get wrecked or lose all your funding or you had to borrow or to be in debt. That means what it means is not that you as a person has a problem. It's only it's most of it is most likely your health system financing structure. There's a major problem there, right? That's where the problem is coming from, right? We're having an issue there. So when you see people, let's say for instance, we're having okay, we need to contribute for this person to go to be able to see a doctor for his surgery. You should just know that there's a problem in the financing, health financing of that country or that and community. There's a problem there. It's not supposed to happen. It's basically not supposed to happen. Everyone has a role to play, both young people, the government, and everyone will come and play a role. And if these things are being done adequately, people are not supposed to suffer financially, right? That's anytime you see that, it's usually an aberration. It's not supposed to happen, right? Then please you can move next. So we laid the foundation of health financing. And after we laid the foundation, please move to the next slide. And we basically discuss what and when it works, when it fails. These are some of the issues that you might experience in the clinic. And see, this is just like an overview of what's in the guide. and you see these are some of the issues. So when you go to the hospital and you see this, you see this, you see that, just know that we're having an issue with health financing, right? Next slide. And we also discuss the challenges of health financing in Nigeria. And for those that are not in Nigeria, most of our now the focus of the youth guide is currently Nigeria. So most of our discussions is currently in Nigeria. So we talked about out-of-pocket payments, local government investments, insurance coverage, and weak accountability and fragmented funding that is being experienced also. Next slide. Then we looked at how healthcare is paid for in Nigeria, and so that you'll be able to understand that, okay, this is where the problem is coming from, right? And for Nigeria, we know that most healthcare is funded by out-of-pocket payment, right? That means it's Nigerians that are taking the burden on themselves. They need to sort. It's just as if you sort out yourself, right? That's how it is. It's not supposed to be that way, right? It's not supposed to be that way. We have supposed to have very, very strong health insurance structures in such a way that out of pocket payments will go down. So it's just as if what we have, the A here, the out of pocket will be substituted with the C there. So out of pocket going down and insurance taking most of the majority, right? That's how it's supposed to operate. But we're having the opposite in Nigeria. So move to the next slide. We also looked at UHC, some of the issues we currently have in UHC. Since 2015, our UHC goal has been going down, right? Most of the indicators have been going down. We've been off track since 2015. Instead of going up, we've been going down. And most of these government commitments and how, because we are talking about universal health coverage and health financing core is key here, right? So, and move to the next slide. We also look at health expenditure indicators, total health expenditure as percentage of GDP, and government health expenditure, what it means, per capita health expenditure, what it means, out-of-pocket expenditure, what it means. We looked at some of the key issues so that when they are talking about health expenditure at any level, when you see it, you should understand, okay, this is what exactly they mean. This is what it means basically. So we had to like look at this so that when these discussions are being made, you basically understand what we are talking about. Move to the next slide. And so after we were able to lay the foundation on this key issue, basically the concepts, the foundations, and everything, we started looking at some of the health policies that are relevant to health finance in Nigeria. One of the major one is the Basic Healthcare Provision Fund. This is like one of the major health. When you're talking about health finance in Nigeria, this pops up like top on the list, right? So established under the National Health Act, we discussed how the funding goes and it's being allocated across different agencies, right? Move to the next slide. We also looked at the National Health Act, the National Health Insurance Act, which made health insurance mandatory for Nigerians, something very, very important also, and develop of the Vulnerable Group Fund also. So we give an overview of the National Health Act, National Health Insurance Act, right? Move to the next slide. We also looked at the health sector renewal investment initiative. This is like one of the top. It was launched in 2023, so it's very, very recent, right? Like not very, very recent, but it's recent compared to the other policies, right? It's something that everyone is also supposed to be aware of and know it. So we also discussed on that and the primary healthcare under one roof policy also, and because primary healthcare is key. So, how exactly can young people make a difference? After and displaying this foundation, talking about health financing and the rest, and we cannot just talk about this and not like give clear and ways in which young people can be involved, right? So you have to stay informed. That's like the major thing. You have to look at, okay, how exactly is health financing operating at any level. Like let's start from the community level. Your local government, your state, and at the federal level, you have to look at how exactly is this funding going. And you can visit the budget office website, be able to see the healthcare budget for Nigeria. And budget is like one of the major key also source. Just go to their website, you get a lot of resources, and on you will see infographics, see a lot of resources on how funding goes, right? At all levels. You can go to your state website and also check like these things are available. You can also ask. You can also even do your own research and so that you can stay informed because it's very, very important. And also enroll on health insurance schemes, so very, very important. And third, demand and transparency. When you go to a PHC, is there drugs available? What exactly is the problem? And you can raise this at either on social media or you can raise it to the appropriate authorities, right? You can engage and innovate also. These are just like some of the ways you can be involved, but this is not like definitely not completely, right? So there are different things that you can do at the community level. Can let people aware of okay, this is how exactly supposed to be done, and about these issues at different levels because it's very, very important, right? And move to the next slide, please. I think that's all for now. So that this is just like an overview of the youth guide, and the youth guide will basically give you more details on this and to walk you through most of this. It was written in kind of like an informative way and basically starting like kind of an interactive way whereby you it lays the foundation, it gives you an overview of what exactly it is, and it directs you on what exactly you can do at the community level, at basically at any level. And the link will be shared for you to download it and go over it after this or during this event. I think they might share it, the chat for you to download and go over it and see how exactly it is. So that's all. You can also scan this, just screenshot and scan, and you can have access to it also. So thank you very much. And this the complete overview of the guide. I hope I just didn't take so much time. So thank you very much.
Right, thank you so much, Joshua, for that elaborate presentation. We can give him a round of applause. You can put in your stickers or in the chat box. Thank you so much for such an amazing presentation. I'm not sure if anyone has a question. Kindly drop it in the chat box so that Joshua can answer before we conclude the session. Do we have anyone with a question? You can raise your hand. You can also send in the chat box. All right. Okay, I can't really see the chat box. Joshua, are you able to see any question in the chat box?
For now, there's no any question. I don't know if
All
anyone
right.
raised their.
Okay, yes. As you said, we'll be able to share the link for this guide to the group so that you're able to download. We encourage you to read it, discuss it, and you can also share your feedback. Yes. So, in the interest of time, I know we mentioned we will be done by 8 p.m. West African time. So I'll now invite, if there are no questions, I'll invite Ogenimini to give the closing remarks so that we conclude the session. Thank you so much, everyone, for joining. Is Ogene in the chat?
Oh, yes, I am. Okay. Hello,
All right.
everyone. I would like, on behalf of FK Strategies, as we bring this webinar to a close, I would like to appreciate everyone for being present at the call today. Today we have marked the International Youth Day 2026, and we have not just honored the energy and creativity of young people, but we have taken a step forward to launching the first published health financing youth guide.
And worthy of note is that this guide is it's a tool, it's a roadmap, and it places young people at the center of conversations that have far too long been held out about them. And it has equipped us with knowledge to engage in meaningful health financing decisions that shape our future. So at Educare, we believe that the bedrock should be equitable and proper financing behind healthcare systems. And so this launch is our contribution to that belief, and is an invitation to every young person, and not just young people, everyone, institutions and decision makers, to join us in being informed about proper health financing systems. So we appreciate everyone being on this call today. And as we close, we want to share a resolve that the youth of today will not only inherit the health systems of tomorrow, but they will help to design those health systems. They will help to finance those health systems, and they will help to lead those health systems. So thank you very much once again for joining, and happy International Youth Day 2026. Thank you.
Thank you so much, Eugenia, for that amazing closing remarks. So with that, thank you so much for joining, everyone, and I think we can end the session.